So the doctor has prescribed you sodium bicarbonate. This medication is considered an alkalinizer and also an antacid. The reasoning of why the doctor has prescribed you this medication is because either for metabolic acidosis, if you're experiencing any urinary alkalization, sorry, or if you need like an acid. And sometimes this medication can also be prescribed or be administered because of a cardiac arrest for emergent. So the way that this medication works in your system, so it's a systemic alkalizer. So what this medication does, it like helps balance out too much acid in your blood. And what it does is adding a bicarbonate into your blood, which neutralizes the acid to raise your pH balance that's in your blood, and which is helping a problem caused by acidosis, which is too much acid in your blood. So if the doctor prescribed it for you for your urinary alkalizer, so what this does, it helps remove extra acid through your urine. It raises the pH of your urine, making it more alkalytic, which is less acidic, which is help breaking down or preventing uric acid kidney stones. When this medication is used for like an antacid, which is for your stomach, the medication neutralizes the acid that's already in your stomach, which relieves heartburn or acid reflux. What it doesn't do, it doesn't help stop your body already making acid, but what it does do, the acid that's already there, it makes it less irritating. So how do you take this medication? The medication can be prescribed to you PO, which is by mouth. So if this medication is used for your urinary alkalinization, you could take this medication without any regards to meals. However, if it's an antacid that this is prescribed to you for, you're gonna actually wait 1 to 2 hours after meals, and 2 hours apart from any other medications. So either 2 hours before or 2 hours after, with a full glass of water. What you can do is you could actually take the tablet and either get it dissolved into 120 mils of water, if that helps you drinking it down compared to like actually having a tablet to chew, or you may swallow the tablet whole, whichever you prefer. Now, if the medication is prescribed to you through IV, which is like emergent or in hospital setting, the nurse is actually going to want to pick a large peripheral vein with a small bore needle, which is recommended. You're going to want to flush the line prior to administering the medication. And when administering the medication, you're going to avoid rapid administering or rapid infusion, which if it is done, it could actually cause pain and irritation to the vein. And then you're going to want to adjust the rate for the patient's tolerance. Common adverse effects for this medication that you're going to want to look out for, which is some edema, which is swelling, belching, flatulence, nausea, gastric distension. The patient may notice some pain to where the IV infusion is going through, and you're going to want to adjust the rate, because other than that, it will subside. The patient can also experience some cellulitis, a skin ulcer, metabolic alkalosis, which is the complete opposite. So when we're trying to treat the acidosis and you're receiving so much of the sodium, which is the base, the sodium bicarbonate, is going to cause you to be alkalosis because you're having too much of that in your system, and can also cause tissue necrosis. When taking this medication at home, you're going to want to call your provider if you're experiencing any of these, which is acid indigestion, heartburn, a sore stomach, or an upset stomach that lasts longer than 2 weeks. And you're going to also want to stop the sodium bicarbonate as well. Also, if you're breastfeeding or pregnant, you're going to want to speak to your provider prior to starting the medication for clarification. Also, you're going to want to avoid taking this medication with milk, as this causes high calcium levels in your blood, which can cause kidney stones, abnormally high alkalinity in the tissues and fluids. Also, if the patient is on a sodium restricted diet, you're also going to want to clarify this with the physician as well. If you have any more questions about this medication, go ahead and give us a call, or we could go ahead and answer them right now. But thank you.